To me, being culturally competent and having cultural humility are important aspects that I want to carry into my practice being a nurse practitioner. Um, to me, culturally competent is including things like patients' beliefs, their language, their value, the health practices that they believe in their culture, and implementing with the best evidence based practice available. Culture humility, um, to me, it's a lifelong commitment to self reflection, and to learning, to do my homework, to do research, to be more aware of someone's culture. And I know that this is something that I'm going to have to work on my entire life. I actually have a really good quote from the Chapin and Bacata's model of cultural competency. Um, it starts with just effective care requires ongoing development in cultural awareness, knowledge, skill, encounters, and desire. This is what I really like is that it states that this framework emphasizes that cultural competency and cultural humility is not a destination, but a continuous process. And I think that is incredibly accurate, is that this is a continuous process that I will have to continue develop on, can commit my entire practice to is being up to date, being aware of the political climate, being aware of how social standards are changing, and how can I continue to respect that and also implement it into the care that I provide for patients. I was very fortunate. I got to work at a sliding scale facility, so we got to work with um, a large number of the Hispanic population, African American population, Asian population, Caucasians, homeless people, people with insurance, people who didn't have any paperwork at all. And we were able to provide care for them. And it helped me be more culturally competent of the care that I could provide to people. A great example I have is your middle aged man, Hispanic culture that develops type 2 diabetes. Statistically, they are at a higher risk for developing type 2 diabetes due to culture, due to genetics, due to lifestyle, all the above. Um, and I had multiple examples of this where, you know, you have that conversation with them and you say, hey, what's your diet like? And you hear that they're very culturally competent in their diet and they have a lot of carbohydrates and a lot of sugars. And it can understand that those foods are not beneficial for a type 2 diabetic. But I can't go in there and say, hey, well, you know what? Everything that you grew up on, everything that you respect in your culture for in terms of diet, out the window. You got to eat this and this and this from now on. And that's part of cultural humility. How would I feel on the other side if someone was telling me that all the food I grew up on, I can no longer eat? So that's part of, and this is just one example of, how can we combine a patient's culture, a patient's diet, and their medical conditions and combine them all to one to provide one holistic plan of care. And that's just, I got to do that multiple times in the clinic. And, I'd always say, hey, I'm not here to pitch out everything that you grew up on, everything that is in your diet. I am not throwing that out the window. But let's come together and let's develop a plan that, doesn't put you on insulin in the next 5 years. What can we do to make things better? And then another thing that I got to, just another example, is like the cost of medications. Most people don't know what metformin and Jardiance cost and other medications cost, but our patients take that really strongly to heart. And that's a conversation we say, hey, this is a new plan. We're going to put you on this. How much is it going to cost? So working with patients and understanding that, hey, I'm not going to be able to put you on the $400 a month medication that I know will work, and there's all this research and there's all this excitement about. But you know what? These medications, I know that they're affordable, and let's come up with a plan of care, and let's touch base in 3 months. And you know what? If this is probably going to be the cost of it, how's that sound to you? If it's, oh, well, I don't know, okay, so what medication assistance program can we sign you up for today? So those are some great examples that I had. And then I got to know which local facilities around my area would allow patients to apply for financial assistance. So like a cardiologist, a neurologist, when you needed imaging done, they can't be stuck with $1,000 bill. So how can we provide those resources and allocate those resources to our patients? And that is the solution to the problem, is knowing what resources are available. And as a provider, I'm going to continue to practice this cultural humility. I'm going to commit myself to learning. The cultural competency is just going to require me to, take the extra step, do the extra thing, do my homework, and understanding, the changes in culture and how I can be more culturally aware. So when I come across my patients, I can be prepared, I can be ready, I can meet them in the middle. This is going to increase compliance. Can please help with adherence to the program, and this is going to create more successful for the outcomes for the patient and myself, and this is going to optimize their quality of life.